The patient I chose for this assignment is a 56-year-old African-American male. He is married and works in IT at Ford Motor Company. The patient's chief complaint is impaired mobility and activities of daily living due to a recent C4 Asia B spinal cord injury. The patient was a restrained driver in a motor vehicle accident with a tree on October 9, 2012. The patient's injuries included a cord contusion at the C3 through C6 level, displaced fractures of the C5, and an interspinous ligament tear from C3 to C5. Since being admitted to 6A rehab at the University of Michigan Hospital, shoulder pain and the low blood pressure are aggravating factors to his condition. Pain medication and getting adequate rest at night helps with his progress in physical therapy and occupational therapy. He is completely dependent with all activities of daily living. The patient feels he is generally in good health aside from his physical limitations with having a spinal cord injury. The patient hopes to improve his strength and degree of mobility during his hospital stay. During hospitalization of the accident, the patient had a sinus arrest and deep vein thrombosis. Prior to the accident, the patient has a medical history of hypertension. Patient's immunizations are up to date and has no known drug allergies. The patient's surgical history includes a posterior fusion of C3 through C6, a posterior laminectomy from C4 to C5, an anterior cervical discectomy, an anterior fusion from C4 to C5, and as well, he underwent a dual-chamber permanent pacemaker implantation on October 15th. The patient's current medications include 15 milliliters of chlorhexidine glutamate rinse orally 4 times a day, 40 milligrams of enoxaparin subcutaneous injection at noon daily, 2.5 milligrams of midodrine 4 times a day orally, 500 milligrams of calcium carbonate 3 times a day with meals. He also receives multiple meds for bowels for treatment of constipation. He receives a bowel program at night with a suppository. As well, he has 3 oral pain medications for treatment of his neck and shoulder pain. The patient was completely independent of his activities of daily living prior to his accident. He reports to be a non-smoker and drinks 3 to 4 beers once a month. He reports to be a healthy eater and receives an adequate amount of sleep each night. However, this has decreased while in the hospital as well as his appetite. Some demographic information: the patient lives in Novi, Michigan with his wife. They have 2 kids who do not currently live at home, ages 22 and 19. He reports to have a strong faith in God and receives communion while in the hospital on a daily basis. He feels he is coping well with his current state, however, he experiences anxiety about his future when he goes to bed at night. He hopes to return to work in IT at Ford Motor Company after he gets out of the hospital. The patient does not have any financial concerns and is on HMO medical insurance coverage that he claims has been very good about covering his costs while in the hospital. Since the patient's chief complaint is immobility, it is important to perform a musculoskeletal and integument assessment. A musculoskeletal assessment will detect any changes in his level of strength and mobility during his course of therapeutic rehabilitation. An integument assessment is also very important for this patient because immobile patients are at very high risk of impaired skin integrity, which is why this is very important for this patient. After conducting a review of systems of the integument system, the patient denies feeling any bumps, bruises, or any other changes in his skin. He denies having changes in his hair or nails. He denies having any dryness or itchiness at all in his body. Patient is aware he has a rash in the sacral area but does not have any sensation in that location. After conducting a review of systems for the musculoskeletal system, the patient reports having some range of motion in his shoulders. He states having a constant ache in his neck and shoulders with a 7 out of 10 pain. The patient reports having extreme limitations in his upper and lower extremities and needs full self-care for all activities of daily living. Now for the physical assessment. His baseline vitals were temperature of 37.8, heart rate of 87, respiratory rate of 20, blood pressure of 123/60, and an oxygen saturation on room air at 95%. After conducting a physical assessment, his skin was normal for race, dry, warm, intact, and his mucous membranes were intact. He has a healed incision located midline at the back of his neck. He has incontinent-associated dermatitis that's visible in his sacral area, as well as dry skin on his penis. There is no edema present, and his nails are normal for race. The patient has normal hair distribution and no visible large varicosities. After doing a Braden scale assessment, his Braden score is 14. There is now a skin integrity care plan in place. After conducting a musculoskeletal physical assessment, the patient has normal bone structure and mass. His posture while sitting is normal. He has no scoliosis, lordosis, or kyphosis. The patient has no crepitus in his jaw when opening and closing the mouth. He has a +3 strength and full range of motion with gravity in the neck and shoulders. There is no swelling or edema or crepitus in his shoulders. Below the point of the shoulders and in all extremities, the patient has no muscle contraction with strength grade of 0. When I ambulated the extremities, there was no contractures or crepitus present. A neurological assessment is also important to assess the patient's sensory and motor movement ability with a spinal cord injury. According to the Anesthesia and Intensive Care Medical Journal, the level of spinal cord injury determines the extent of the neurological deficit. Nearly all spinal cord injuries damage both upper and lower motor neurons. In an Asia B incomplete spinal cord injury, sensory but not motor function is preserved below the neurological level and extending through the sacral segment of S4 to S5. A respiratory assessment is also very important according to the Anesthesia and Intensive Care Medical Journal. Spinal cord injury patients have unique care needs, particularly related to respiratory system. Respiratory problems now comprise one of the major causes of death in acute and chronic phases of spinal cord injury, especially among quadriplegics, like this patient. In general, the higher the level of injury, the greater the respiratory compromise and the greater need for ventilatory assistance. The patient's condition is an incomplete spinal cord injury, and he's no longer in the acute phase of his injury, so a respiratory assessment is still a priority, but it's not the most significant assessment at this point in time.